uh, discussion on sort of what you're seeing in the field regarding hiring and some of the tips and successful pieces you have so far. And then we've got, and then Anne, I know, sent you some specific questions to also kind of keep the, broaden the conversation out. So we'll start with Cindy.
So hello, and thank you for having me here. I am, and I have my timer. I started my timer, so I have my timer to follow because I can talk. A couple things that we have been noticing from the educational side that is that, okay, so I'm trying to process how to introduce this, but one thing about the CHW role, and we all know this, is that we want to hire, or you and your organizations want to hire individuals that are from your communities or the communities that they serve. And that is a very broad statement. And as we know, that could be ethnicity, race, condition, housing, economic, whatever that may be. And from an academic lens, our job is to recruit those individuals, to get them into the academic pathway for education. And that recruitment side is always a challenge. One thing to keep in mind about a community college, any community college you're talking about, at least in the state of Minnesota, I believe also nationally, is that community colleges are open to anybody who has a high school degree, international equivalent, or a GED. Okay, so keep that entrance requirement on your forefront. And those of you who have kids going into college or have gone in the past 2 years have realized that the entrance exams, AccuPlacer, or even, those types of entrance exams or assessments have changed. Okay, and I'm giving you this big picture because students are coming to a community college because they want a change in their life. They want either a change of career. They never thought they could go to college and they're coming to college. There's a variety of different reasons why an individual comes into our doorway. And their placement is based on some of their self-assessments. So some of the ideas of like AccuPlacer and are people placed in English, or EAP, which is English for academic purposes, or certain math levels, okay? Those are all adjusting based on new research on success. And so I'm bringing all this up because one of the challenges that schools have is, one, recruitment to get students into the program. Because sometimes we are recruiting students who have never seen college as their pathway. Most of the students we get have been recommended by somebody else or a former graduate that have learned about it. And we do have some students who come in who have bachelors, who have masters, have an associate's as well. So, but what I'm trying to show is that the students that we're getting are coming into an academic culture that is very, they have to learn that academic culture. They may not have, they've never been exposed to it. And so those of you who went to college the first time or have kids who are going to college, you realize there's this huge learning curve. That's what we're dealing with people who are possibly in their 30s. So we have technology to get through for those. And so one of the things is we are working with students to help them be successful, and some are far beyond and some aren't. And so those are the students we are priming and giving them this dream for a job and a career and stuff they've probably already been doing. The one thing we need is that we do internships. And a majority of our students work as jobs as well. So they have to pay their bills. And so they can't not work and do an internship, but they also want the experience in areas that they're interested in. And so as a college, we are trying to bridge that in between and do some of that career bridging pieces of resume networking, because for some students, this is brand new. You know, some have it, they have a great resume, great cover letter, great interview skills. And some we're working on those new skills. And so that is a way that education is interested in working with employers, is how to be that pathway to good paying jobs.
Thanks, Cindy. Cathy. And welcome, Adri. Glad you joined us.
Okay, well, so you already, and you know my role I come as both an employer, Stratis Health as an employer, and as my relationship and role from the Alliance. I personally do not hire CHWs, and I just want to disclose that, so you aren't thinking I have this wealth of experience, which I don't, about hiring CHWs. So what I want to do is speak a little bit more broadly to both the journey Stratis Health itself is going on, and just challenge us to think a little bit different when it comes to our recruitment processes, or the way we seek to hire a CHW. You know, many of us have always sat down and written a job description, which came with a whole set of expectations and requirements, and then a set of skills such, or what we call at KSA's knowledge, skills, and abilities, such as requires a 2-year degree in blah, 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 requires 3 to 4 years experience. And I challenge us to think a little bit differently about whether or not those are the kind of things we need to actually be seeking when we seek candidates. Perhaps we think differently about what are those things we need to be successful in the role. So as a CHW, an important thing that we would want to find out or seek candidates for are those who can demonstrate or show experience in having developed trusting relationships, those who are really good at connecting services. So if we stop putting some of those parameters on them or challenges to bringing people into the field and think a little bit differently, I think we might be able to start to broaden some of the scope of those we get to reply to our recruitment. I also challenge us to think about there we go. It just left my brain what I was going to say. I apologize. Okay. So talked about challenging ourselves, thinking differently. Oh, how we ask for those individuals to respond. And I'll tell you, some of this is things we at my own organization are really trying to push ourselves on. We would have posted a job. We would have asked for a resume. We would have asked for a cover letter. And then we would have decided based on those pieces of documents who we might bring in to interview. What we're doing, really pushing ourselves to think about, I want to hear from potential candidates why they can show me how they can do the work. I don't necessarily want, or I'm asking for resumes anymore. I'm saying, you tell me how you think you meet the clearly identified expectations of the job. So I also challenge us to think about that. I don't have an answer to, but I absolutely agree that thinking through the salary issue is really important. Folks want to know up front what we're going to pay for those jobs. You know, Stratis Health traditionally did not post its ranges. We've started doing that. We have found that more folks are applying to our jobs since we've been doing that. So understanding what is how do you even put a fair wage around it? But I agree with the issue that came up earlier, is trying to think through what is important for salaries. What else might I add to that? Oh, I think it's really important for us to try at the upfront to identify as we get ready to seek and do our recruiting, what perspective we're trying to represent with this hire. Truly understand, we don't want to just hire for the sake of adding more diverse or certain representation to our staff, but what is it we really, what are we missing on our staff and what are we trying to fill? And then finally is challenging ourselves about the networks we're using. If we're using the same old places, going to the same old resources to recruit, we're going to get the same old type of candidates. So networking, this kind of a group is an excellent place, but thinking through where we go for our networking and recruiting and putting notices of positions that are open. So I will leave it at that, and thank you.
Thank you, Cathy. And what is Stratis starting CHWs at right now?
Stratis does not hire CHWs at
Oh.
this. We do work on the other side of it. We
I
work
see.
with
Yes.
others. We're about health.
So you're
and-
posting those salaries, but it's not CHW.
right
Thank
on
you.
any of our jobs. So thanks for the question.
Thank you. Okay, Lydia.
Hello. So I sort of had an outline of things that I wanted to talk about today, but then hearing everybody talk, now my mind is sort of full of a whole bunch of other things. So I might not seem as organized as I plan to be. But I just want to say, as a community health worker myself, and I was coming from being a community organizer, specializing in outreach and advocacy, and that's what had drawn me to the field in the first place. I went to MCTC, got my certification, and immediately got a CHW position with Catholic Charities in the emergency shelter medical respite. But I will tell you that interview process that I went through, I actually did get up and walk out when I heard their first offer. She did offer me a position right at the interview, which also was a little bit strange, kind of off-putting. But she offered me $16 an hour, and that is not a livable wage for literally anybody, not even worth a part-time position. So I can hear all the considerations around paying a CHW. What I can say about that, also, I try to keep up. And when I look on websites like Indeed, ZipRecruiter, all of those, number one, I see that there are a lot of positions out there that are not exactly using the title community health worker. So I think there's an issue around that. And so in any of your ads that you're putting out there to hire and recruit, just be sure you're putting the term community health worker. So for those of us who are certified, we know exactly, that what you're looking for. There's a difference though in who you're looking for. And one of the things also in those job ads that I see is that they're not specific enough. So I don't know who your community is that you're serving. A lot of the times they'll just be very general. And I understand that it needs to be general so that you think you're casting a big net. But I think in our field, that doesn't quite work because we generally are very credible messengers from very specific communities. And so we need to know that. So if you're looking for the things like Cindy had mentioned earlier, ethnicity, race, class, your gender, put that in your ad. We need to know. And also on top of that, you will likely get people who are more passionate about their work as a community health worker, because they're like, yes, that's my community. That is who I want to support. That is who I want to uplift. And I know I would be the best person to serve them. So that's just a couple of things are the job titles, being clear in ads about who, and that wage is critical. Like I said, I did end up walking out of my interview. She ran down the hallway and called me back and said, wait, let's talk about this. Okay, so we renegotiated a compensation package that was more amenable to me, but also did include things like a go-to card, a Metro Transit card. Just all, just be willing to accommodate the person that once they've inquired about the job, I would say at the first interview, make sure that they feel comfortable enough to know that they are also interviewing you. And I do think that that needs to be said specifically and overtly, explicitly, because so often we arrive at these interviews really in a messed up position. You know, we probably are struggling financially, but still what we don't want for ourselves and also for the employer is to end up in a situation that in the long term is not going to work out for any of us. The other thing I would say about pay, so I do think that, you know, we need to be starting our CHWs at a livable wage. And I think you can look at that, like ways to figure that out are, you know, as a renter, I'm also a renter. I know that when you move between apartments, they're going to ask for 3 times your wage, and $16, $17, $18 is no longer going to cut it anymore. So if you want to have a CHW that is looking for long-term, wants stability, you want to build that relationship with them and help develop, you know, that livable wage is just critical. So I just want to make sure that that's out there, because I am in my communities of CHWs, people I hang around with and talk to, that's our biggest issue, is we're just not making enough money and it's not worth our time. And so we end up applying for other jobs that don't hold the CHW title, you know, things like, I mean, it could be anything really. We're highly trained. So it could be patient registration. It could be intake and assessments. It could be strictly just health education, but then they're not using CHW and they're saying we don't need a certificate, stuff like that. There's all kinds of things in the work field that are creating obstacles and barriers and limiting clear communication between who we are and the employers. The internships. I was one of those people that could not afford to do the internship at the same time of working and still continuing school. What happened is that first position that I went to, that was one of the things I specifically told the interviewer at the time, is that I had not yet completed the 2-credit internship requirement because I simply couldn't do it. And so for her, that was a oh no moment, right? But in our conversation specifically, she called MCTC and said, hey, you know, I really want to hire this person. What am I in the position to have her first 2 weeks as a hired person? Would that work for her internship? And they worked it all out and talked about the criteria and everything, and it was fine. So I was able to actually complete my internship on the job, and then was officially certified just 2 weeks later. It was awesome. So I would like employers to consider that. I think Kristen mentioned that working specifically in like the public housing. I think MCTC would really be a good resource for that. And I did hear people mention that they're recruiting from community colleges, and I do think that's critical. But I also think that if you don't have the budget, now this may sound a little bit crazy, but in my communities, this is actually an idea that is developing. So we're recruiting from high schools to go along the path to community college, high school graduates to community college. And I know in my communities, oftentimes we look for a vocational position to get our life started in the first place. We need that solid vocation to move forward. Say we do want to eventually earn a bachelor's degree and a master's degree and go on, but how are we going to afford that? How are we going to stand on our own 2 feet? You know, being a CHW is entry level in a lot of things. Like we just heard, there's public housing positions, there's positions in medicals, there's positions in housing services, all the human services, there's potential. So I think that's another way, is to just like dig really deep into communities, but then also like your CHWs may or may not. I'm here in the Twin Cities, so I'm hearing that a lot of people on this panel and in this meeting are not in the Twin Cities. So I just want to make it clear, my perspective is sort of very Twin City. So it's probably different where you're at, but maybe these things will, you know, get your mind thinking about how to recruit, what it means to recruit. So the pay, offering to pay for the internship yourself. Going to the actual classrooms would have been helpful at MCTC. That is one of one of the things my whole class talks about all the time from our very last day of class, we're like, where are the employers? You know, and our instructor, you know, that is not necessarily her role or her position. So there's a gap there, you know, who can be this connector, a very effective connector. And that's something that we definitely need to look at. But as employers, if you're looking for CHWs, I would send somebody out to the school and set something up to stand literally in front of the classroom and introduce yourself. And then be very specific about what type of person you're looking for, because there's a good chance they're in that classroom and they just don't know how to find you or where to start. So that would be another thing. But I think mostly it's the identifying your community is the you know, like be really specific about who they're going to publicly face, who they're going to be on the front line. Everything you can write about your community being served is going to be helpful for any CHW looking for work. You know, hopefully they'll be like, that's my community, I'm going to apply right now, you know, and then we go from there. But again, what I am seeing in a lot of the job ads is lack of specificity. You know, they don't put it, and we definitely do need to know that, especially here in the Twin Cities. You know, Somali, let us know, who are you looking for? You know, are you looking for somebody that's already in public housing? Because that's another area. I have been working with, I work in public housing too in my neighborhood, and I see it, I can see how a CHW there on site would be so helpful. But again, there's other obstacles as far as systems and, you know, just administrative and policies and procedures. But there's a pathway there, and there's a lot of opportunity for developing community members yourself. So it, you know, it'd be hard to get that in the budget, but I would encourage everyone to try. Sorry, thank you, I'm done.
No, those are amazing points. And I thank you. And then you're going to have to share more in our discussion part 2. And I took a lot of notes. So thank you. And Chantell.
Just to go back to the compensation piece, what we're doing here at Wellshare is that we're actually looking at our job descriptions and looking to make sure that what a director is being paid versus what a CHW is being paid versus what a volunteer, or not a volunteer, but a program coordinator is being paid, and to make sure that their jobs aren't intermingling and intermeshing, so that that tiered level of compensation is something that we can say when we do offer something to a candidate. Okay, well, we're only going to go so high because we know once we reach a certain level, then that's a director level position. I think the other thing, the process of hiring a right candidate, or make the process easier, I guess, I would say start from the beginning. Please let people know that they need to have their certifications. Please let them know what exactly it is that they're going to be doing. Don't be super broad in your job description, because then you have everybody applying for it, and then you're rejecting applicants that could be utilized in a different area or a different field. I have had many applicants that I'm taking a look at right now that I say, well, you're not qualified for this, but you're qualified for that, but I still have to reject them and see if they'll go along with the other job. The other thing I would say too is, like, what does your branding say like about you? What does your company say about you? Everybody is doing like the great resignation, and it's because they're unhappy with their work culture. So if you look around and you see that your CHWs are asking for more training, but you're not providing any of that training, or they're asking for more, I guess, expectations, and you're not providing that, then they are going to look somewhere else for another job that is going to provide them with what they're looking for. It's less like policy and procedure, I would say now, and it's more like collaboration and innovation, meaning people want to have, they want to be a part of their hiring experience. They don't want you to just tell them like, well, this is what we're going to do, and this is how we're going to train you. People want to know that they're a value asset to the company in which they're working at, and then what are you going to do afterwards, meaning training, certifications, job like movement. People want to see a progression in their overall experience. And then the other thing I wanted to say is like benefits are not something that just attracts people anymore. It really does boil down to do they get meshed along well with everyone that is in the company or who they're going to be working with? Do they mesh well with the job? Are they going to be bored? Is it something that they're going to want to be doing? Or do you have somebody working in family home health that doesn't really like talking to people? You have to make sure that you have managers and supervisors that have actually managed people and know what that work is like. And I know here we offer a flexible PTO because based on our clientele, the people that work for us, they need to have the option to be able to travel and to be gone for long periods of time. And so, realizing the culture and who you're serving, I think that's huge too. We did have an employee survey that went out, and expectations, training, and overall like movement were the top 3 things that people were asking in regards to that. So the other thing too is just there's been a shift. So if there are people that are not used to utilizing online, please just help them through that. It's COVID, and we understand that not everybody may be up to speed. Like Cindy was saying, we have some people that are in their 30s that have never utilized technology. And so we have to be cognizant of that. And I think the last point I want to say is that just have active listening, meaning there should be check-ins with your CHWs. There should be, I say, weekly check-ins, if not bi-weekly check-ins, to see where they're at, to see where they're struggling, to see if there's anything that they may need, and to let them know that you're a partner with them and that they're not alone. And in my role, since I do human resources, I'm trying to put away the scary face of human resources and really say, here, I'm an advocate for you. So if you have questions, if you have concerns, if there's something that you need, please come in and let me know. If it's something where you're not able to address it with your direct supervisor, but you feel like it's an issue, that's something that we need to talk about and we need to address. So that's all I have to say, but thanks, guys.
Thanks, Chantell. That was really helpful. And our last panelist is Tara Nelson, and then we will go to Q&A, but take it away, Tara.
Thank you, everybody. So I work with IMAA, and that is a nonprofit, and we serve refugees, immigrants, but many of our programs now in the last 5 years have transitioned to all populations. It's not just refugees or immigrants. It's more folks with chronic conditions, fighting with socioeconomic needs, all those kind of things. So we are one of the largest employers in the Southeast area for community health workers. Right now, I've got 14, and I'm currently hiring right now for another one. And within the next month, I will probably be looking for 3 or 4 more. We work very closely with Mayo Clinic, and Mayo Clinic has got a lot of projects in the works right now. So I need to have teams ready to go. So as I'm looking to reach and hire community health workers, I have to agree with what Lydia said. I actually do. I go to the schools, I talk to the kids, I talk to the colleges. I'm out there in the community every day, involved in all the groups that I can. And some of the best candidates are the students or the folks who are actually receiving the services that we're trying to help them with. They are working folks, they have rent, they have kids, they have needs. So, and they also have just this wonderful ability to know about the services that the community provides, and they are well intertwined in their communities. Most recently, we know that we've had some families come in from Afghanistan. I am currently working with Catholic Charities and trying to also work with those individuals to onboard them at some point, because I think they would be a true asset to some of the members that we're serving right now, helping them acclimate to a new region, a whole new life. So I really agree with what Lydia said, being right there, talking to the folks who they're actually utilizing the services. One of the other things that we have found really successful, and we've gone through a lot of CHWs. I've been at IMAA for 9 years, and I have onboarded 43 CHWs in those 9 years. So we've had turnover, and a lot of that is because of salary. We have to pay these folks what they're worth. They are working very hard. As we know, the CHW role is kind of an extension of a social worker. We are truly valuable to all the different agencies that we work with because we're that connector piece. So making them feel valuable, including them in on the conversations. So when we onboard somebody, we have a very comprehensive orientation schedule. CHWs work one-on-one with myself or my assistant supervisor for 90 days. We do not just unleash them. We really try to introduce them, walk them around, get them acclimated to the work that they're going to do, but then also include them in what could we do better? What other places could we touch and change lives? Having them part of those conversations, such as Chantell said, letting them be part of the strategic planning on how we grow this role. The CHW team that I have, not everybody is certified. I hire people who are not certified, and I work with Minnesota Department of Health, Department of Higher Education, and I put them through the training. There's no cost to them. I give them time to do this training. Our last class, we had 15 individuals. It ended up being 2 years because they have families, they have lives. With distance learning, it created such a barrier for everybody. And then their internship was done as they were working. So they had a paid internship. We're very flexible at IMAA, again, because of the employees we have. We know that for somebody to go on a vacation because they may have to go overseas, we're flexible to give them a month off. We're flexible with the remote work a little bit to keep them safe. There's a lot of different ideas in the community on vaccinations and all that. We want to respect everybody's wishes and their desires and how to best keep their families safe. So those are some of the different things that we've used. Now, we tried doing it just through social media, but while we know social media has a great effect on many of our communities, we did decide to go through Indeed. I've gone through the school boards or some of the different job boards, but those job fairs, really, really important. People want to talk with the person one-on-one. They don't want to really Zoom with me and they don't want to email with me. I like to interview all the candidates. I don't pick and choose because some people do not come across well on paper. But when you're sitting in front of them, you look at them and you think, oh my gosh, I need you on this team. So I think it's really, really important to just look at the person as the person and not if they can write, I can teach that. Not if they can, be so perfect on Zoom and stuff. I can help with that. I really want somebody who's going to connect with another person and really share kind of what's inside of them, build that trust. And I usually can tell that within 5 minutes after sitting down in front of somebody. There's a warmth that comes out of that person. They have empathy, they have compassion, and they're the best employee, whether they've had another job or they haven't. I like to look at resumes to see what their background is, but I truly just like to visit with the person. So those are just a couple of the tidbits that I look with. And again, I'm actively looking for a CHW, just offered a position to a person this morning. And I feel very fortunate that we were lucky enough to get the applicants we got. But as you are putting out your job postings, if you have time, interview everybody, give them a chance. So thank you.
Thanks, everybody. I think that's our whole panel. So I think we'll just start with, this is a good team. Pop in, ask your questions, and or share your own experience and expound upon the conversation that Cindy, Cathy, Lydia, Chantell, and Tara got us started with.
Yeah, I'm wondering at IMAA, so we do the same thing at Wellshare where we're putting people through the process. And I think that I really appreciate you bringing that up our hiring practices are also equity practices, right? So making sure that we're able to interview everybody, give everybody a chance to that might not look exactly perfect on paper. But when it comes down to it, I can only bill for services for a certificate holding CHW. And if I have programs that are supported through claims-based billing, at least in part, it's really difficult to see that. And it is sort of a hampering of the workflow, the workforce development as a whole. So I'm wondering how you get around that, or if there are ways that in that hiring process that you can think about that, you balance between certificate holding and non-certificate holding hires, anything like that.
That's a really good question. We are fortunate that Mayo Clinic puts us on their operational budget. So they don't bill for our services. We are part of the patient care team. So we are now just most recently getting access to Epic, and we will be doing charting and everything in Epic. We are considered one of the care teams. So they're not billing specifically MA or any of the other insurances for our services. We're just part of that care team. I hope that helps.
I just wanted to, after listening to everybody, and I think I put it in the chat, that from the instructor lens, and then also on the recruitment for sites for CHWs, all the things Lydia and Chantell and Tara said, and Cathy, are what students are talking about. That's what they're saying their needs are as future employees. And one of the things and I highlighted some of the stuff after everybody was talking, but that, Carrie mentioned, I think in the chat, we can't pay CHWs that because we're paying 4-year and master's degrees that. So as people were talking, I just did a quick little search on other certificates like HUCS, surgical techs, pharmacy techs, and surgical techs. And they are all making 16 to 24 an average as certificate holders as well. And so the certificate is equitable to other certificate things. And like Chantell said, and I've seen Hennepin County, actually Human Services did this, is they did reevaluate all their job descriptions to see what are the roles and how can you get individuals to the top of their scope, so that the CHW is a part of that team. Because one of the barriers that students have or have bad workplace experiences is that they walk in and nobody knows what they're supposed to do. And they said, and we prep our students to say, we are teaching you how to be advocates for yourself. A lot of places may not know how to use you. They want to use you, but they really don't know how to use you. So I have spoken to the internship site to ask, is it okay if the CHW pushes the lens, pushes the boundary? I talked to the mentor, the supervisor, because that's one of the barriers is they're like, all I'm doing is answering phones, which answering phones is an important part. But if the CHW doesn't see how that is part of the bigger scope of what the team is doing, their lens is, I'm just answering the phones, and so that is where and I was on a call earlier about this. It's where the team has to be prepped for the CHW before the CHW comes in. So they know how, they're like, sweet, we have the person we need because we get to do this, this, and this. And so that's hard. I did want to talk, I just wanted to, and I want to let people have questions, but talking about the enrollment with high schools, community partners, and jobs. I've been talking to a variety of employers, and one of the barriers is they post a job and nobody with a certificate applies. They only get bachelor's degree students. Like Cathy said, make it simple. But if you put CHW, if you put you need an associate degree or a bachelor's degree in the preferred, not preferred, in the recommended, they won't apply. Even if it's in recommended or in the optional or in the, if you put a degree in there, they won't apply, because what I have learned through different things is those of us who have been through the job searching process for a while, we know you're not going to hit, I'm not going to hit every bullet that I apply for a job in. Nobody does. Our students don't know that. They think they have to hit every bullet that is down there. And that is a barrier, because they're like, boom, boom, boom. Oh, it says they're looking for an associate's degree. And I'll say, it's down here in the maybe part. Yeah, I'm never going to be able to compete with someone with a degree. Boom, they've never applied. And so like Tara said, talking to people, the recruitment police, don't ask for a resume right away, ask to have a phone call with our students. And we're willing, you know, ask to do mock interviews, but you're really not interviewing, but you kind of are. So the students can be real with you. You know, and it helps them practice their interviewing skills. But if you're looking for people to fill your jobs, there are ways to make the connections. And schools, community colleges are, we call the middle child. We're between the high school and we're between the jobs and the bachelor's. Come to us, we will partner in 4 or 5 different ways, as long as there's a job there. Students will do it if there's a job.
Thanks, Cindy. What other thoughts? Robert, did you get a chance to weigh in? Looked like you were on the verge.
Yes, I was. First, I just wanted to say first, I want to thank Tara Nelson for what she was discussing. One of my charges is that to hire 100. Yes, and this was just told to me the other day. I thought it was just going to be 18, and then I found out no, you get to do all of them. And I said, okay.
Robert, tell us again where you're located.
Oh, I'm in the beautiful state of Mississippi. So with that landscape, let's segue into, you know, just a little bit. Now, I've been hearing some of the things that many of you are saying, and it makes me feel somewhat validated that I have. So I'm sort of like in a political position as well. So there's a lines that I have to walk very thinly. However, but there are lines I get to cross since there's a new office, but I'm the only one in it. So no one knows if it's the only correct or not. Well, one of the things that I sort of told myself from a conscious perspective that I wanted to do intentional diversity and inclusion recruitment. Those words to me meant something to me, but I realized I had to create a narrative for the office to understand that. So, like I explained to EOE, it's not intentional diversity. They're not the same thing. You can have EOE all day long till you're blue and purple in the face. That does not mean intentional diversity and inclusion. The second thing I want to say about my pathway that I was looking at was ensuring listen to the ground floor, because when you're in, you know, this outfit, and CHW is now the hottest thing on the ticket because so much money is being dropped. I also recognize that there's an advantage when you're looking at lay people that at one time people thought they were in the way or were not wanted. And so now people are looking at them and asking questions, but can they do this and can they do this and can they? And I had a beautiful, at first I love Cindy, Ann, and Audrey. They've been like my 3 sisters on the other side. I probably talk to them like almost every week. And, you know, one of the challenges is that, you know, I have 82 counties, and I have to make sure that I have individuals in those counties that are representative of these different counties. So, you know, of course, I had to go and create a county map, break down demographics, class, income, all this kind of good stuff, and then look in and seeing what do I need to get. And I've had to be very open, you know, coming, you know, even though I'm from the South, I left and went to DC 20, you know, years ago. So I have a whole different thing, you know, leaving, but then I had to come back, I had to get rebaptized. And I had to sort of explain to them, you know, and you know, you have to sort of say words that can sometimes challenge people, but we have to call it as it is. I'm in Mississippi, so we just can't get around with it. And so I gave myself permission. You know, I was nervous, you know, and state health officers meeting, you know, justifying this new Office of Community Health Workers and the recruitment. And I just had to say it. I said, look, you know, we're not going to have, we're not having 100 people that look like me. We also going to have some men, and I need to have individuals that reflect the full spectrum of what Mississippi looks like. And I said that also needs to be included individual with certain type of special needs, as well as LGBTI representation. Of course, everybody got quiet. They didn't say nothing, but the silence is golden. But I'm still moving forward. I think one of my challenges have been is that I'm in a state where the training has been going on for years and had not been oversight. I just got hired in April to try to clean stuff up. Lucky me. And so, you know, I have these outside entities who have been training CHWs, but no one really knows what they've been trained on. I've had people from the outside who sort of called me and was, you know, sort of said certain things, you know, about what they've heard about training. And one thing, like I had pressed upon Adri and Cindy and Ann, was that the goal is to have standardization, have that scope of practice for people to understand and walk through. That's why I told the internal team in here, it is mandatory, and I'm getting that from the state health office, for them to make it mandatory that when we do the CHW training with the Minnesota Community Health Alliance, that everyone in every department under Office of Preventive Health and Health Equity must be on that Zoom call for 3 hours. So just clear it up, you know, it's mandatory. And I was happy about that. And also I was happy about the fact that they are in agreement that the pathway that we've created with Minnesota and doing a pilot-based program, like I told Ann and Cindy, I'm stealing everything off their website, borrowing, and just kind of making it Mississippi because I like the website. I had no other choice. I came in with nothing. So, you know, I saw a lot. And so we're there, everyone is on board looking at that CHW secondary pathway as going to be the standard, and that everyone that's going to be hired in MSCH must go through that CHW certificate program. But I told them I need to see the language first, and then I share with Minnesota on the side to make sure it's correct.
Thanks, Robert. It sounds like you have done a ton of work and are shaping an entire state for the CHW program down there. And we're pretty proud from Minnesota to be able to have that standard that I think is nationally recognized for rolling out CHWs. What other thoughts do people have? Thanks so much for sharing your story. And we're going to, and hope you'll keep joining us. Connie,
this question actually is for Robert. This is Connie Norman, community health worker in Bemidji. Are you going to, you have a huge undertaking here. Are you going to be picking like 1 or 2 counties out of 82 that will be your pilot project? Or is it
Let me,
rollout?
well,
Yeah.
no, that's not how Mississippi works.
Wow.
You see, you got to remember now, Mississippi, like Texas, they do their own thing. So, but because I create a rationality, I said, listen, you know, I'm a former high school teacher from Baltimore. Let's do this. So my goal is to get 18 to deal with the chronic disease aspect and get them in February, and look for them to go through the course first, because there is no way that I by myself, we do have office community health workers. There are 4 people, but only 1 person's been hired. Everyone else keep resending their resume. So I've just sort of assumed myself as being a one-man show until they tell me somebody's coming. It's like, don't tell me somebody you interview, just let me know the day they're coming. I'm gonna just do everything, and if they want to come in and do something different, that's fine, but at least they have something to work with. No, here how it's going to be, Connie. The beautiful thing about us is that we like to do everything at the same time. And so,
Robert and Connie, I'm gonna hope you two can connect
Yeah.
afterwards, and we can even leave the Zoom room open. So anybody who wants to hear more, like, I feel like that's an amazing conversation. And for right now, I want to keep us back to, like, how do we recruit and hire and retain these fantastic folks who are out there, but we're struggling with that. What other thoughts and ideas do people have to on what's being successful for you?
Could I just ask a question real quick?
Yes.
As far as retention goes, and funding a position, I'm wondering what specific grants, like the grant language that people are currently using to fund. So is it all health related, or, is there capacity building, and what are some of the, like, the grant?
Well, I can speak for our area. The lion's share of our grants right now are related to the opioid epidemic. And so we've gotten a lot of opioid money to support this work, because care facilitation, when in our area, we're focused on social determinants of health and behavioral health. And so addressing those both in folks who are attempting recovery or starting recovery, but it's also a preventative piece. And so we're able to serve the full population using that language. What other thoughts do people have?
ours is on COVID response and resiliency, and we have, like, I think, too much money, really. I'm scared of it because, but we're looking at it, and we actually have decided to reframe the term social determinants of health. I asked to do that for a specific reason, because of in this state, language is very important for this state, and coding is as well, especially when you're trying to bring bipartisanship to the table. We're not trying to segment, one group. So the way that we're going to create the language on the website is that we're looking at to address vital conditions to that can make determinations around social determinant health and within the rural health. Because when I've learned that if I use certain phrases in this state, people in the Pine Belt area would get it. People in the Northeast Mississippi would get it, because you got different mindsets. So you say social determinant health in this state, they immediately just think one thing. And it sort of came out a couple weeks ago, and that's not what this office is. This office is to address the vital conditions that every Mississippian is dealing with. And so that's what we're looking at we're reframing. Social determinants will always be under it, but it's just that having that to be, in other states,
So you're using the vital conditions of health.
Yes.
Excellent.
Yeah.
Thank you. That's great language. What other things are people doing? Kelly?
I'll just pop in there. I mean, a lot of our startup funds has been related to the hub model itself. And now, and Vanessa can kind of speak to kind of how we're like moving into the contracting side. And but the hub model is braided funding model. So we have some of the dollars coming in from payer contracting, and then various grants. So it's just been kind of program based. Kind of, I mean, I think of it similar like to your comment, Heidi, on the opioid epidemic, having additional programs that are specific to like diabetes or ED utilization or whatever it is, might be one successful pathway. Yeah.
Thanks, Kelly. Other successful ways you've approached things? So I wanted to do just a quick, if you can type in into the chat box, if you're willing to share what your pay scale is for CHWs or whatever you call them in your area. If you would just type those in real quick, I think that would be wonderful. Cindy wants to ask how the school can help employers get hires. So she's got students and thankfully started this January session also. So best ways to get students into positions with your organization.
And I know many of you have like sent stuff out, but that model is obviously not working. So we like, what other ways could we work together? Connie, I'm sorry.
So Heidi, I have a question. We're actually, this might be for Lydia as well, or whoever. I know Lydia was mentioning being very specific about who you want in terms of being that community-facing individual, but I'm wondering where the balance is between keeping the job equitable in terms of all individuals from all communities indiscriminately getting the position versus getting that individual who will be able to be that community connector, especially in terms of grants and keeping it equitable.
I'm curious if I could state, so I've been trying to envision this since Lydia spoke, how I would do this. And I'm curious to get the feedback from this whole group, thinking that we would describe and say, something like people of color, LGBTQ, and people who are great with people, but don't necessarily have the perfect resume to match this job are encouraged to apply. Is something like that what you had in mind, Lydia, when you're saying be really specific?
Well, I think just to clarify, specificity in who is being served. So who are you? Who is the community that you are serving? What is it, a rural community? Describing that first. But in addition to what you said, just Heidi, I know in my communities, communities of color, faith communities, stuff like that, we do look for those specific words. So I know that I appreciate that. There's a lot of reasons why when you say, by POC, encouraged to apply, it really does have the impact of encouraging us. So I just, that's my main thing is like, put it there if it matters. But more importantly, being very specific about the community which the role would serve. Yeah.
On that same note, I think that the workplace matters as well. So we've found that the skill set for clinically integrated CHWs is drastically different than the skill set for community outreach based CHWs. And so we're actually looking at some sort of different training regime or different sort of like internal training program that will really go over a lot of those clinically integrated necessities. And Chantell could probably speak more to this than I can, but previously, I know that we were thinking about how to test some of the competencies or the work experiences in a uniform way that are required for a clinically integrated CHW. You know, it's just it's a very different and sometimes sort of opposite skill set for somebody who's doing general community outreach, which is a very specific skill set that you know I don't have, and then like the clinical integration component where somebody is working closely with clinicians and they maybe have to use an EHR and you know all these different things, and so it's such a wide ranging scope of practice that it's something that we've noticed that as well. And it's a great thing about CHWs is that they're so versatile, right? But not every person who's been through the program has that full range of versatility.
I would also like to add that I actually have had to go into these communities specifically to ask someone to, you know, like I have the job announcement, right? And I sent it to them. And I'm waiting for 2 weeks and no one has applied. And so the lady said, do you mind if I do a webinar and I invite them and I want you to speak to them and explain to them what they'll be doing? And, you know, for one community and specifically, it was interesting because 2 things came up and it was in regards to their safety. And I thought that was very important. I let them know that we do have a safety platform that would be built in and that we will go through those things in terms of how to protect yourself, especially in a state that when you have to, when you're disseminating information around COVID-19, there's still large populations around vaccine hesitancy. And so, you know, we want everyone to feel protected, as well as special populations. I've had to find out how do I connect with these, you know, with special populations, because I don't want this office. I want this office to be the segue to everything in the office. Like it's to be the resource hub. So when a person calls, say I need rental assistance, but I'm dying of cancer, where can you go? If someone says, you know, I don't have my HIV medication, I just moved into the state, instead of them having to call order departments and so that's what we're building a resource directory as well.
Yes, CHWs really need to know their community and the resources. So I want to wrap up by asking if you have a job description that includes some of these specificities, or particularly an ad. So I think if we would all be willing to share job descriptions, ads, those salary ranges, and then we didn't talk about interviewing very much, but more that informal, sitting down with somebody face to face and just having an exchange more than an interview, really trying to get a feel for people. Those are some of the things that I heard us really talking about during this conversation. And I think the more we share concrete items with each other, I'm wondering if, Adri, if it's possible, do we have like a SharePoint site or someplace where we could all put documents that would be easy to access? Or are we better off kind of electronically? I know I often lose those passwords and then can't get in. So I'm wondering, should we share electronically documents, or do we need a site? And that's something we can discuss, because I know most people need to be popping off now. But if anybody has thoughts, I'm curious, because